You're watching the Randy Alvarez Business Report. I'm Randy Alvarez. Today we're talking about continuing education, continuing dental implant education. With us, we've had him on my program before, Dr. Mike Tran. Dr. Tran, welcome to the program.
Thanks for having me, Randy.
Now, you know what I like about you is not only are you an educator teacher, right, but you have a super successful, high dollar practice. So not only are you teaching it, but you're doing it every day.
Correct.
I mean, you're doing a lot of arches.
Yes.
Is that right?
That's right.
Like you do fixed arches in like 2 or 3 days?
That's correct.
Like somebody, I don't want to put words in your mouth, but so people know the kind of dentist you are. Somebody could walk in, you could do their extractions on day one, and the following day, they get fixed upper and lower teeth in a temporary. Is that correct?
That's exactly right.
Is that rare or is that common?
Oh, no, that's common. We do that all the time in our practice.
Okay. So that leads me to talk about your 3D Implant Institute, okay? We're in San Diego. You're doing a program right now, like a hands-on training in Mexico.
Correct.
Right across the border. So let's talk, because I guess you have 2 types of courses. Your digital course workflow, and then you have your surgical hands-on training that you say is an immersion course. And you like to think it's a little bit different. So let's start there. Who should attend this course? And what will they learn?
So anybody who wants to get into dental implants should attend this course. I mean, I'm in San Diego right now, as you mentioned, because our first live hands-on surgical training was sold out in the first week. So crazy enough, we had to do 2 back-to-back courses because honestly, in the USA right now, about 25% of general dentists are placing implants. In other countries, about 85 to 90% of the general dentists are placing implants. So it's coming and it's coming fast. So if you're not placing dental implants, you're gonna get left behind.
You know, we talked about this in the green room, that the future of dentistry is almost all dentists will be an implant dentist.
That's correct.
Is that right? It's kind of like, if you don't, I compared it to the taxi business. Like the taxis were around for years, and then Uber came along, Lyft came along, and they ignored it. And now it's too late, because they're trying to do their own online apps, but it's too late. Do you think dentists are in that position? A lot of them want to do it, they're thinking about doing it, and they just can't take that step?
That's correct. So what holds us back a lot of times is the fear. We're unknown, we don't know how to do procedures like dental implants. But you know, as we say that if you get the training, you're gonna leave our course, you're gonna be confident, you're gonna be placing implants right at the end of the course. In 5 days, you might not have even placed an implant ever in your life, and you're gonna leave with confidence.
Okay, so this is a 5-day course. These are not cadavers, these are actual people from Mexico, and some are coming in from Canada.
Correct.
And the US.
Yes.
So does everybody get to place implants in those 5 days?
Everybody gets to place the dental implants. So what we do is we do the live hands-on surgical training in Mexico. But before that, you're gonna get online webinars that you're gonna get all the didactic parts.
Okay.
But the best part is once you take the course, you're gonna be in our private group chats, and you're gonna always have somebody to answer your questions and walk you through your implants.
Okay, so is this for the beginner, the intermediate, the expert? Tell us.
That's a good question. So we have 2 programs that's set up during the same time. We have the beginner to intermediates, where if you haven't even placed an implant, you can learn from A to Z the whole workflow. Also, we have doctors coming back. We have another doctors coming back this week that started off with the beginner intermediate, and they're coming back to do the full arch workflows where we're placing the 6 to 8 implants, a minimum 4 implants, and then we're 3D printing the teeth, and these patients are receiving a beautiful new smile.
So even in Mexico, you're doing this 2 or 3 day approach. Is that right?
We're showing exactly what we're doing. We were actually the first course that had the new photogrammetry impression methods, having both of them and letting the attendees place the implants and also deliver the teeth, getting all hands-on training.
To do it in 2 days or 3 visits, you have to have printers. Is that correct? And you have to have mills.
Correct.
Is that right? And some of these, I guess, for the complete setup, could be as little as $50,000.
That's right.
Is that right?
Yes.
I mean, for everything, and you're ready to go.
Yes, sir.
You just have to learn how to do it.
And that's where we come in.
So you have Dr. Ardik Patel and Dr. Aman Buller. Is that right?
That's right.
And these guys are also instructors. Do you all 3 do the same things, or each one of you do something a little bit different, or teach something different?
We have a lot of overlap because they're very, very skilled surgeons, have gotten a lot of training. But there's some things that Aman has his philosophies and Hardik has his philosophies, and I have my philosophies. So you're going to get all that, and a lot of them overlap. But we do different things. I do a lot of the newer procedures like socket shield, which is called partial extraction technique. I do a lot of the soft tissue grafting at the course, and the other guys, they're really doing the full arch workflows, and I'm with a lot of the basic intermediates doing the complex grafting and socket shields, things of that nature.
You know, I asked you in the green room also, I said, you know, how do you really see yourself different? You said that many of the top guys are doing a great job. You were very complimentary, but it's a lot of it, you're watching them do the surgery.
Yes.
And you want to be a little different. Can you elaborate on that?
Yeah, so a lot of the top guys, I really look up to them. They're leading the way there, but they do the surgery in their office, and then you're watching the surgery. You're not getting any hands-on. So our idea was to make it all immersive, hands-on. That's the best way to learn. So we'll take you to the live hands-on surgery. You'll place the implants and learn the workflows from A to Z.
So it's everything A to Z.
Yes, sir.
So you've had people that have gone to the course. How soon do they start placing implants on their own? Like, what are some of the stories you've heard?
Oh man, we had this one doctor who actually just went on your show recently.
Who's this?
Dr. Angeli Zamora.
Okay, Zamora. Yes,
Zamora.
Dr. Zamora.
Yes, and she's doing 5 to 6 arches, full arches a month now.
Yeah.
She's gonna grow, probably with your help, probably to 10 to 20 a month.
Yeah, she's pretty excited about doing it. So she went to your course, and she was brand new to this. But she also doesn't have fear, right? I mean, it takes a bold person to just start doing it.
Yes.
Right?
She's definitely bold.
So 5 days, is that enough?
It's never enough. So we always tell our attendees, this is the start of your journey. And then we have the full arch course that you can come back and do. But even that, this weekend we're an educator. Other weekends we're taking courses. So you're always trying to learn and try to keep up with everything. But then we show the digital workflows and we deliver these brand new smiles and everything's perfect. But to really learn the ins and outs and the nuances of the digital workflow, we have a 2-day digital hands-on lecture that we do all across the country. So you're learning how to 3D print these teeth that we're showing.
So, okay, so the digital workflow course is a 2-day course. Is that for just the more advanced people?
So I still work on teeth. I'm still doing big cosmetic cases. So we're gonna do the whole workflow. How to treatment plan these cases. Am I saving the teeth? Am I not saving the teeth? We'll do full mouth crowns and veneers. We'll 3D print the temporary, show you how to do that, show you how to do digital orthodontics, and show you how to treatment plan and go through the whole workflow. So at our course, we've already picked the printers that we're using, but at the digital course, you'll learn about which printer pick, which was right for you. Different doctors might have different needs and there's different price points. So you're gonna really figure out how to make this within your budget and give you the best ROI. So how to do a digital smile design and how to make all the technology work. Because you don't want to spend a lot of money, and I get this a lot. Doctors are like, well, this is a lot of investment, but we're going to show you how to make money on your investments.
Okay. You know, I did my first dental implant interview 24 years ago, right? I've seen a lot of personal changes. I mean, things that used to take, 6 months, 10 months to finally get to the final, now you can do in 2 visits and get to the final much faster. So do you think it's ever going to get even faster than this, where you get them in the final the second day? Because is that already happening?
Oh yeah. So you talked about getting 3D printers in mills. Right now we're 3D printing, and it's good. It can last about a year, 2 years. So we mill out the final restoration. But we're saying now in 10 years, we're not even going to need to mill anything. We're already printing ceramic restoration, porcelain teeth already. So
okay.
There's a limitless possibilities. We're already printing metal, so everything that we're milling now, we're going to be able to 3D print, and you'll be able to get that in an hour or 2.
Okay. How many people do you have in your courses? Like, where do you want it to be?
So for the hands-on course, we have about 14 to 18 doctors there, and for the digital course, it ranges from about 30 to 50 attendees.
Could you make a quick comment on grafting?
Yes. So grafting is very important. So like, not everybody's going to have a perfect ridge, meaning you're going to have a lot of bone. So you might place an implant, you're going to need to place bone grafts or tissue grafts, and we go through all of that in our course. So we teach whatever comes in our office, we're going to teach the attendee. So if the patient needs tissue grafting, a lot of the times in our courses, you're going to get the tissue grafting. If they're going to need bone grafting, we just did some big bone augmentations this past weekend, and you're going to get all the surgical training that we do in our office.
Now, you're one of these guys that goes to a lot of courses.
Oh yeah.
I think when I first met you more than a year ago, 2 years ago, you were like a CE junkie, right? So did you model this training program that you put together to be like the best of the best? Did you go out to be like number one, like secretly? Did you say, I want this to be the best course?
Well, I traveled all over the world to get my CE training. I just sought out all the best instructors, but every course has a little piece that they do well. This course does well, and you learn all those things, so that's why there's no secrets. we try to give all the information that we've learned in all the courses, try to make it the best implant course that we can give.
Good. I want to thank you for coming on our business report. Thanks.
Thank you so much, Randy.